Hi everyone, welcome back to my YouTube channel Flex and Fix Physio for Shri Krishna Physiotherapy Center located at JP Nagar, Bengaluru. In this video, let us learn something about the second most common type of arthritis, which is the rheumatoid arthritis. Rheumatoid arthritis is the chronic autoimmune disorder, that is the hormones which are produced in the body affects one's own joints. It is usually correlated that the HLA-DR4 is the hormone which usually affects the autodestruction of the joints. We all know that rheumatoid arthritis usually affects the smaller joints in the body. That is, it usually starts with the fingers, wrists, and when coming to the lower limbs or the legs, we usually see toes and the ankles usually mostly getting affected. Apart from these smaller joints, we can also find rheumatoid arthritis in the other bigger joints. That is, it can also affect knees, hip, low back, neck, or even the elbows and the shoulder. Apart from these common affected areas of rheumatoid arthritis also rarely affects skin, mouth, and heart also. So there are 4 stages which an rheumatoid arthritis diagnosed person has to undergo with. In stage 1, there is pain and swelling in the joints. In stage 2, the cartilage which is present in the joints go for the distraction along with an increase in pain and the swelling. In stage 3, we do find the pain and swelling is comparatively increased, and we also see the bones getting involved in the destruction of the joints. In stage 4, pain and swelling might reduce or decrease, but the destruction in the joints continues to happen. So what are the common symptoms that we see in rheumatoid arthritis patient? As we had said you in the stages, we do see pain and swelling. We also see morning stiffness in the joints. That is, as soon as a person wakes up, he cannot move his ankles, toes, or fingers in the joints that is affected. We also see fever. We also see weakness in the person who is affected with rheumatoid arthritis. So, coming to the common these are the symptoms that we saw in the persons with rheumatoid arthritis. So, what are the causes of rheumatoid arthritis? Obesity is the major cause for rheumatoid arthritis. Apart from obesity, that is the second common cause of rheumatoid arthritis. First one is its own autoimmune disorder, followed by obesity, tobacco chewing, smoking, and even the emotional stress or the mental stress also triggers rheumatoid arthritis. Apart from this, we also see the genetic predisposition, that is, anybody in the family or the ancestors who have a history of rheumatoid arthritis can give this disease to the next generation. Usually, females are more affected than males in this rheumatoid arthritis. Coming to the common complications that we see in rheumatoid arthritis is there is a deformity in the joints, there is disfiguration of the person that is who has been affected or diagnosed with rheumatoid arthritis. So, coming to the diagnosis process in the rheumatoid arthritis, we all know that rheumatoid arthritis or any arthritis person usually undergoes 2 types of diagnostic process apart from the physical examination. As soon as a person visits the doctor, it is the physical examination which is done in by the doctor in his clinic. Secondly, he would prescribe for the hematological examinations or the blood tests, which includes the ESR level, CRP level, and rheumatoid factor examination. The third important diagnostic process is the radiological examination. Here we do a plain X-ray, MRI scans, CT scans for the diagnosis of the rheumatoid arthritis. Coming to the management or the treatment of rheumatoid arthritis. Rheumatoid arthritis is usually treated by 2 methods. One is the pharmacological method and the other is the non-pharmacological method. In pharmacological methods, we use disease modifying anti-rheumatic drugs. We use NSAIDs and corticosteroids for the management of rheumatoid arthritis. Coming to the non-pharmacological methods, we usually use acupuncture, physical therapy, then we also use splints, exercise prescriptions for the management of rheumatoid arthritis. Do take care of yourself, because rheumatoid arthritis usually affects a large section of the people in the society. Anybody who comes across with these symptoms, do visit yourself or take care your loved ones to the clinic or the rheumatologist to get diagnosed and treated for rheumatoid arthritis. Take care of yourself and visit Sri Krishna Physiotherapy Center for the guidance and management of rheumatoid arthritis. Thanking you.